The COVID-19 death toll in Uganda currently stands at 133, with the numbers expected to rise as the country gets to terms with phase 4 of the deadly virus that severely affects the respiratory system. It's also the political campaign season, where gatherings are inevitable.
Phase 4 means people getting sick without even knowing the source of the infection. So under phase 4, this phase is so deadly.
From the time Uganda registered her first COVID-19 case in March 2020, the total caseload now stands at 14,704, with about 7,000 recoveries. The Health Ministry projects that the death toll will rise in phase 4, as seen in other countries that have completed or are in the same phase. Although many Ugandans, especially the well-to-do, prefer private hospitals, the Health Ministry is cautioning private hospitals admitting COVID-19 patients or even late referrals to government facilities.
By the time they refer these patients, it is already too late and we cannot handle. And like that, we have lost lives. So I want to advise, as a minister, that private hospitals, if you get patients who present themselves with signs of COVID, don't admit, just refer to save life.
The Ministry of Health is warning the entire public against dashing to private hospitals and clinics, especially after presenting signs of COVID-19, which include headache, cough, and loss of taste, among other signs. But what will they do to some of the hospital and clinic owners who might be adamant and continue to admit such kind of patients, since this is a business?
If you don't, through our national task force, the Ministry of Health, top management, and senior top management, we shall be forced to revoke some of your licenses.
As the Health Ministry does its best to save lives, the burden of burying COVID-19 victims has now been left to the communities. Junior Health Minister Nabbanja told NTV that they don't have enough resources. Previously, only Health Ministry officials and volunteers from Uganda Red Cross Society were allowed to bury COVID-19 victims. However, the Red Cross has since pulled out of the program, and yet government alone does not have the capacity.
The 3 teams in Kampala kept moving all over the country, to the north, to the east, to the west, to do burials of suspected cases or confirmed cases. And each team has about 10 people, including the body handlers, the drivers, those who would communicate to the community. And so that meant that each time you're deploying a team, you have to cater for these 10 people. There are allowances for overnight in some cases, plus of course the transport costs. And we had to have 2 vehicles, one to carry the team and one that would carry the body. So definitely with time that became very expensive.
The State Minister for Health, Robinnah Nabbanja, told NTV that government hospitals handling COVID-19 cases will prepare bodies before handing them over to their families for burial. But how about religious and traditional norms that some families might want to perform before burial?
Don't open the body bag.
And in case someone dies from home, under the recently introduced home-based care for COVID-19 patients, Minister Nabbanja counseled as such.
We shall devise means of making sure that we expedite the process of making those body bags available at all facilities of government.
The Uganda Red Cross Society will help government in providing the body bags and other body treatment requirements. A relative of the deceased will be allowed to witness the treatment of the body in strict conformity to other standard operating procedures,
so that they can see the body and confirm that that's their relative, just to allay fears and anxieties or the need for other family members to open the body bags. Because once it's prepared, the recommendation is that they should not open for viewing at the burial grounds.
According to Uganda Red Cross Society, the burial teams have interred 146 people, including confirmed and suspected COVID-19 victims. Sudil Biarhanga, NTV.